Hey everybody, happy Global CE Day. I want to present today quickly for a colleague, Murad, Subih, a clinical engineer in Yemen, who's back home these days from some of his graduate work over in Malaysia and has bad internet, but wanted us to deliver this message, so I'm helping out today. So here is a report from Yemen for Global CE Day from Murad Subih, clinical engineer and CED collaborator, and it's based on our personal communications recently, a report he did for that's on the CED website on the CE status in his country a year ago, and then a more recent report in July from the Doctors Without Borders colleague, Hugus Gardner. So what's the situation in Yemen? The history of biomedical and clinical engineering in Yemen is it's considered, the field there is considered a unique major, and it's only 2 private universities and a lot of fees. So not a lot of engineers have graduated from this program yet. What about healthcare services in Yemen? Well, there's, like a lot of places, there are 2 types: the public hospitals that are funded by the government and a lot of NGOs, and they get medical equipment and so forth from donations that way. And the private hospitals are pretty expensive, and so donors are the main funding there for private hospitals. What about clinical engineering challenges? Well, because of all these donations and funding from foundations, there's not enough information and a lot of problems in operation, a lot of broken devices and storage. Not surprisingly, most hospitals do not have a clinical engineer. Sometimes people can be called on to repair. Sometimes there's contracts, but there's really not enough budget in those public hospitals for this field. And so not as many clinical engineers in Yemen yet. A challenge. A special challenge in Yemen, of course, is the fact of the ongoing civil war and the huge demand on healthcare services. So not only the various diseases that most countries face, but a lot of rehabilitation. Disabilities and amputation are very widespread, and a lot of assistive devices needed. And Murad shared that with us in Rome last October when he joined us there. And so once again, they need to be able to create the prostheses, and that's expensive. And Murad himself is working on that with his graduate work. But now I'm going to switch gears and talk about some interventions that we learned about in July from Doctors Without Borders. There's many NGOs, non-governmental organizations, that are going to Yemen to help make a difference. Here's some of the excerpt from Huga's report, who's a part of the MSF team. And you can see here behind the conflict in Yemen, as it says there in the middle, there's a widespread COVID-19, too much demand on health services, not enough, not able to meet that need, particularly need oxygen, and need treatment centers focused on this. So we know about that. So what did MSF do? Well, they started dealing with the oxygen supply challenges and helped address that across the country. This is cool slides. They've increased their human capacity of, to help bring more clinical engineering capacity, human capacity to the country. They've opened a hospital. They've repaired some of the machines. They've done oxygen production. So this is an example of what NGOs are doing in that country to make a difference. And thank you so much, both Murad and Hugus, for bringing attention to this particular place. Thanks, everybody.